Hi again, Dr. Lee Coleman here, and thanks again for coming back. You know, if you're going to have so many things to say, as I have, if you know from previous sessions, about what's wrong with the mental health system, what's wrong in psychiatry and the role of the drug companies and the medical model, psychiatry in the courtroom, you ought to have some suggestions for how it should be done instead. So I want to take that on. Some of it I know I've talked about in pieces here and there, but let me say a little bit about what I would be my dream plan. Of course, these things can only happen slowly, society, because we're talking not about the doctors or just one part of it. This is a social issue. And these things change slowly, but they're never going to change if we don't go in the right direction. And as a matter of fact, I think we've gone in the wrong direction to a very strong degree in the last 50 years. I was trained in the late 60s, and that's when things start to go very wrong, in my opinion. Well, the first place I would begin, but probably the last place that's possible, would be that we wouldn't have involuntary psychiatry at all. So let me talk a little bit about that. Right now, we have two systems of social control, but only one of them is labeled as a system of social control. That's the criminal justice system. The criminal justice system exists for protection of society and to basically make our laws be consistent. That is, if you don't have a punishment for breaking the law, then you don't really have a law. You might have a moral precept, something you urge on people, but if it's not a law, I mean, if there's no penalty for breaking it, then the law really has lost any meaning. That's what the criminal justice system is all about. There's no reason to apologize for punishment that follows crime. Of course, social issues are very important. When we have certain segments of society that seem to be committing more crimes, it's not enough to punish people because there's something in society which is encouraging it in certain ways. We could do something about that. Remember, I live in Berkeley for good reason, so you know where I'm coming from. At least you have some ideas. So social issues and justice are all complicated things, but we have a system, punishments we don't need to apologize for. Where the problem comes in is unfair application of the law, unequal protection under the law, but I'm not an expert on those issues. I'll have to voice myself in another arena for that. But we have that second system of social control that's operating under dishonest principles, and that is the mental health system. The mental health system is in significant part acting to control deviant behavior or annoying things that we don't like. And I advocate that we stop using the mental health system as any system of social control. How do we do that? By legislating away the power of any mental health professional to do anything to you that you do not want, leaving them to offer their services for things that you do want, and that you, as the consumer, would always be the one to decide whether you want to continue. Always free to change to a different service provider or to stop it altogether. Well, that immediately brings up the very serious questions. Number one, well, what about if they're dangerous? So we'll have to talk about that. What about if they're not only dangerous to other people, what if they're a danger to themselves? We'll have to talk about that, and we have done some talking about that. What about if they're not able to take care of themselves? Let's talk about danger to other people. First of all, mentally disturbed people are not any more likely to be a trouble to other people than anyone else. In fact, less so on the average statistically. So there's no reason to think that we would suddenly be swamped by violence and other terrible things if we did not have the ability to coerce people into some sort of mental health services. As a matter of fact, I believe that the danger to other people would, if anything, be less if we didn't force treatment on people. Now, you know, the psychiatric community often talks about how people who go untreated then commit a murder or neglect a child or whatever. In my experience, most of the time where somebody who's in the mental health system against their will does something that is dangerous or violent, it's because of their reacting to what is being done to them against their will. So it's a little bit stretching the point to think that it's their mental illness that has anything to do with it. It's the fact that they are caught up in a system where they are being forced to do things they don't want to do. None of us can prove our opinions on these issues, but that's my judgment at least, that an elimination of the ability to force treatment on people would not put our society at any graver risk, and in fact would probably reduce it. Danger to self, the same thing. Psychiatrists often talk about the risk of suicide if they go untreated. How about the people who might be committing suicide because they are threatened by involuntary psychiatric treatment? I have no doubts in my mind as a psychiatrist who's involved in both clinical work treating patients and in the legal arena that we actually have more suicide by people not being willing to allow themselves to get caught in the psychiatric system again, but who have been caught in the past. So they have had the experience of the feeling of a kind of a rape victim, an assault victim, something done to you that you do not want. It's bad enough when those things happen because you make a mistake and you subject yourself, like have an accident because of your own carelessness, or you get ill because it's nobody's fault. But when somebody forces you to have dangerous treatments, confines you, the humiliation that goes with being a forced mental patient, these have serious consequences, and I believe they significantly add to suicide risk and push people into behavior that might be harmful to other people. Now, when it comes to people who are not able to make decisions for themselves, I don't have a problem with the fact that there are situations where people need help and are unable to provide for their basic needs, maybe unable to reach informed decisions about things, where we need courts to act as a decision-making process, a process that investigates to see whether the individual's rights are being protected, but at the same time does not allow society to neglect the area of children, the entire area of protection of children. Of course, children are unable to make decisions for themselves. Sometimes their home situation needs some kind of intervention. But the way we have it now, mental health professionals have such a heavy role in the decision-making process because we medicalize those decisions as well. We too often make it seem as though a psychiatrist, a psychologist, or an individual doing an individual examination will tell us, is the person competent or incompetent? Is the child being abused or not? Instead, it should be by an investigative process which may receive some input from professionals from a variety of disciplines, but the court does not abandon its responsibility to make these decisions based on a balancing act of the individual's rights to protection and the making sure that they are not abandoned by society. So I don't think the abolition of involuntary psychiatry would be as difficult as people seem to paint it. I think it's protecting today's institutions more than a real look into what that would mean. All right, let's move on from that, with or without involuntary psychiatry. Let's move on to what I see as the role of the mental health professionals. And despite the many things I've said in this and previous sessions, I'm not against the mental health professions, but I want to see a different role for them. Let's start with the psychiatrists. They are the ones who have managed to keep themselves at the top of the heap because of their medical background. They get the most prestigious positions with the best salaries, they get put in positions the most often to opine about various things. I don't think in many situations that medical background justifies that position. I'd like to see a mental health system where the medical doctors who have mental health training, or you could say the mental health professionals who also have medical training, those are the psychiatrists, do have special standing when the medical training makes a difference. And in hospital settings with medical patients, that would certainly be one where, as a consultant or as a treating doctor, there are situations where medical issues make it important. We can help the doctors of other types in their work in situations. And there's no reason why we cannot do psychotherapy along with the other mental health professionals. But when it comes to mental health problems, we would really just be one of equals amongst the other mental health professionals. And the reason being is that the mental health system would no longer claim that we are diagnosing our patients. And this is really a critical issue. In mental health problems, mental and behavioral disorders, where there is no known medical cause, and to repeat, all the mental disorders that we know about have no known medical cause. Psychosis or schizophrenia or madness, as they used to call it, there is no known medical causes. Manic depression, depression, anxiety, antisocial behavior, sexual problems, personality problems, there are not known medical causes, therefore there cannot be diagnoses, because a diagnosis is a determination of the cause of the problem. We have no diagnostic tools in psychiatry. But that doesn't mean that we cannot learn about the patient. And by understanding the patient, we can help the patient, or at least do our best. So psychiatrists would have a role in certain medical situations, but when they are acting as mental health professionals, they would be pretty much on an equal plane. Psychologists. Let's talk a little bit about psychological testing. All psychiatrists have to have some familiarity with psychological testing because it comes into your work. If it's been done on the patient in the past, somebody else may recommend it. I've done enough work with the use of psychological testing by observing the testing results of hundreds and hundreds of cases, especially because of my work in the legal arena. And psychological testing is, for the most part, very, very subjective. Sometimes it can get somewhat more objective, but it is always limited by certain problems. And that is, when you do psychological testing on somebody, you are eliciting a performance. That performance might be which boxes you check on a piece of paper, which items you manipulate in a certain way, or how you answer questions. Speaking is something that you perform. The main point is, while you can measure how you perform on how somebody performs on a test, you cannot measure why they perform the way they do. You cannot measure their mind with a psychological test any more than a psychiatrist can. That is their motivation, how much they want to do their best, or their attention. How much are they paying attention, or are they distracted? How much do they have emotions going on at the time that they're being tested? Maybe they don't like being tested, especially if you have involuntariness in the system. We've already talked about that. Then the person's attention may be limited, or they may not want to perform as well as they can. So psychological testing has very severe limits because you're not measuring their body. They're asked to perform with their mind, and that gets into the subjective realm. Nonetheless, psychological testing can be helpful when there is a medical problem that has been diagnosed independently of psychology, and you want to follow the progress of that patient, not only in the traditional medical ways, but in the performances that you give them as part of a psychological test. So there is a role for psychologists in different kind of research areas that would study not only mental functioning, but medical diseases. No quarrel with that, but a very, very large percentage of psychological testing would go by the boards. Certainly there's no role for psychological testing, in my judgment, in the legal system, because there is no psychological testing which is objective enough to help us with decision makings having to do with criminal activity, having to do with whether you're able to take care of yourself, having to do with questions of dangerousness, any of those things. They've all been tried, they've all been terrible failures, and they really cost us a lot of money, and they harm the cause of justice. So we've covered what psychiatrists, how much their role would be limited, the psychologists as well, both of them qualified to work with people in a psychotherapeutic setting. Drugs might come into some of those settings. It's not to say there's never situations, but once the patients were had the power to not be forced to take medications, there would be many situations where they would not be used or not like they're being used now. We have other trained professionals, counselors, who would certainly be qualified to interact in a therapeutic realm. And if they were not being pressured to rely on the psychiatrists for drugs in the way they are now, that would be severely changed. I have recommended many times on public forums that if you're looking for therapy, I would put the psychiatrist at the bottom of the list as a potential therapist because they're less likely to get pushed into a medical arena with medications than if you are seeing a psychiatrist. But there would be a role for everybody to play, just a much reduced one. But let me move last to the issue of what about the role of the patients? I think the role of the patients would be drastically changed if they were in charge of their treatment, which would be the vast majority of situations in the medical psychiatric field. The one thing we've lacked in the history of psychiatry is that the patients could give us the corrective feedback we need as to how our treatments are working. That not only protects the patients, but also helps the therapists. Because if you have a product and you don't get any feedback of how people feel about your product, you can go off in all kinds of cockeyed directions. Patients would be free to change therapists or drop out of therapy if they were no longer second-class citizens who don't make the decisions. I think that a very important thing is they would come for help at a stage when it's most critical that they get it. For those people who get experience in working with mental breakdowns, I want to add my experience. I find that people who are having serious mental breakdowns, a major problem is that they wait too long to get the help. That if they are in a situation which is truly a healing situation, earlier, it's so much easier for them to respond to help. It's so much easier for the people trying to help them to communicate with them. What's the primary reason they might not get involved earlier? Because they lose control, or there's the fear that they might lose control and have things done to them that they don't want, maybe things they've already had done to them that they didn't like. The greatest boon to the patients and to the helping mental health professions would be to only be treating people who want to be there, who truly can engage with the individual in a humane way which gets to the bottom of things rather than manipulating our understanding into some medical frameworks where we do something to them instead of assist them in moving in a different direction. It's a mental health system which I think would be dramatically improved and free our legal arena of many problems, bring more help to patients, cost us less money, and improve in every way. It's not going to happen in the lifetime of anybody who's watching me, listening to me, but we can start a process if we get our thinking in order. And I sincerely hope that some of these ideas might allow you to think about some of these things in a more open way than the psychiatric community and the medical community as it stands now would encourage you to do. So thanks for coming, and thanks for thinking about these issues. See you next time.